Right now, look down at your feet. Just look at them. Because what I'm about to tell you has changed the way dozens of my patients think about their health forever. And it all started with a simple glance at the floor. Most people believe diabetes sneaks up on you without warning. You feel fine, you get a blood test, and then suddenly the doctor's face changes. But what if I told you your body has been leaving clues right there on your feet, sometimes for years? 9 clues to be exact. And today I'm going to walk you through every single one. I practice preventive medicine, and my focus for the last 2 decades has been on helping older adults catch dangerous conditions before they become irreversible. I'm not making this video to scare you, I'm making it because of what happens in my office week after week. Patients sit across from me, 60, 65, 72 years old, and they say the same thing. Why didn't anyone tell me sooner? That question stays with me, and it's the reason I want you watching this right now. The Centers for Disease Control's most recent national report estimates that over 11 million Americans are living with undiagnosed diabetes today. 11 million people, and nearly all of them, every one of them, had signs showing up in their feet first. But before I get into the list, tell me your name and where you're watching from in the comments below. I want to know who's in this room with me today. Every comment gets read, everyone. Sign number 1, tingling or numbness. You keep blaming on the way you're sitting. Here's the thing about tingling feet. We've all had it. You sit too long in one position, your foot falls asleep, you shake it out, it goes away. Totally normal. But I need you to ask yourself one question. Is this happening repeatedly without any clear reason why? Because there is a version of tingling that is not from a crossed leg. It's called peripheral neuropathy, and it is one of the very first signs the body throws up when blood sugar has been elevated for an extended period. Here's what's actually happening inside your body. Glucose, sugar. When it stays too high for too long, it begins to attack the outer sheath of your nerve fibers. Think of your nerves like copper wire covered in protective insulation. That insulation is what keeps signals traveling cleanly from your brain to your toes. High blood sugar is like a slow chemical leak that eats through that insulation over months and years. At first, the signal gets fuzzy. That fuzzy signal is what you feel as tingling. What's remarkable and what most people don't know is that this nerve damage often starts in the feet simply because those nerves are the longest in the human body. The further from your brain, the more vulnerable. The American Diabetes Association has reported that peripheral neuropathy affects nearly 50% of people with diabetes, making it the single most common diabetic complication. And it almost always starts in the feet. My daily recommendation: a 20 to 30 minute walk every single day. Not a workout, a walk. Movement pushes blood into the extremities and keeps those nerve endings nourished. Pair that with one dietary change today. Cut your added sugar intake. Sodas, sweetened coffee, packaged snacks. Now that tingling. Most people feel it during the day. They shake it off. They move on. But sign 2 hits at a completely different time. It comes at night when you're exhausted, when the house is quiet, when there's nothing left to distract you from it. And what patients describe when they experience it is unlike anything else. Sign number 2, a burning sensation in your feet at night. Picture this. You've had a perfectly ordinary day. You lie down, pull the covers up, and then it starts. A burning heat coming from the soles of your feet. No fever, the room isn't hot, but your feet feel like they're inches from an open flame. My patients almost always assume it's fatigue or poor circulation from standing, or just something weird. A few of them told me they sleep with their feet sticking out from under the covers just to get relief. Here's what is actually happening. The nerves in your feet have been damaged enough that they are now misfiring. They send a heat signal to your brain. Even when nothing hot is touching your foot, your brain can't tell the difference. It receives the message and tells you something is burning. It's like a smoke detector with a faulty sensor. There is no smoke, there is no fire. But the alarm is going off anyway because the detector itself is broken. Clinicians who specialize in diabetic nerve disease widely recognize that this burning foot pain is one of the earliest reported symptoms in patients who are later formally diagnosed with type 2 diabetes, often surfacing well before the condition is caught on a routine blood test. That gap between symptom and diagnosis can be months or even years. That is an enormous window to intervene. My daily recommendation: 8 glasses of water per day minimum. Proper hydration helps your kidneys clear excess glucose and supports nerve tissue health. Second, add more fiber to every meal: oats, legumes, leafy vegetables. Fiber slows the absorption of sugar into your blood, which gives those damaged nerves a chance to breathe. If you're finding this helpful so far, type the number 2 in the comments right now. It takes 2 seconds and it tells me you're still with me, because the next 7 signs, they only get more important from here. Sign number 3, a small wound that simply will not heal. Let me describe a patient of mine, 68 years old, active woman. She noticed a small blister on the back of her heel from a new pair of walking shoes. She put a bandage on it. A week later, it was still open. 2 weeks, still there. After 3 weeks, she finally called my office. That blister was the alarm that led us to discover her fasting blood sugar was dangerously elevated. Here's the science. When blood sugar runs high chronically, the tiny blood vessels throughout your body, including the ones in your feet, begin to narrow and stiffen. Oxygen can't get through. White blood cells, which are your immune soldiers, can't reach the wound site quickly enough. The nutrients your tissue needs to repair itself simply don't arrive on time. Think of it like a highway with a massive traffic jam. The ambulance is trying to get through. The supplies are there, but the road is blocked. And a wound that stays open on a foot with poor circulation is not just a slow healer. It is an infection waiting to happen. Research consistently confirms that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, with medical studies estimating more than 80 amputations performed each year on people with diabetes, and some recent reviews placing that figure considerably higher. And nearly every single one of those began as a small wound that was left too long. My daily recommendation: every evening after your shower, sit down with good light and physically inspect both feet. Look between every toe, look at the heels, look at the arch. If you find a cut, a blister, or any broken skin, clean it immediately. Apply antiseptic and cover it. If it hasn't noticeably improved within 48 hours, call your doctor. Not next week, 48 hours. Sign number 4, unusual skin discoloration around the ankles. This one gets missed constantly, and I understand why. Discoloration on the legs and feet can happen for dozens of reasons, but there is a specific pattern I look for: a darkening, a reddish deepening of tone, or in more serious cases, a bluish tint concentrated around the ankles and lower legs. When blood sugar has damaged the blood vessels over time, the lower extremities stop receiving adequate oxygenated blood. The skin, which is in many ways a report card for what's happening beneath it, begins to reflect that shortage. Here's the part most people don't realize. Your feet are the furthest point from your heart in your entire body. They are at the very end of the delivery route. When the blood vessels narrow, which is exactly what high blood sugar causes, the deliveries get delayed. The skin, starved of fresh oxygen, changes color. It's a visible SOS signal from your circulatory system. Medical literature on the cutaneous manifestations of diabetes confirms that these skin changes can appear before a formal diagnosis is ever made, sometimes years earlier, because the vascular damage driving the discoloration begins long before blood sugar reaches the clinical threshold for a diabetes label. It's a warning most people are never taught to read. My daily recommendation: 5 minutes of ankle circles, toe raises and calf stretches every morning. That's it. Even a small amount of movement activates the pump in your calf muscles, which pushes blood back up from the feet toward the heart. If you can't exercise, Simply elevating your feet on a pillow for 20 minutes while you rest makes a measurable difference. If this is still making sense to you, type the number 4 below right now. I want to see who's still here with me because we're only halfway through and the signs we haven't covered yet are the ones most doctors never even mention to their patients. Sign number 5. Severely cracked heels that nothing seems to fix. Cracked heels are extremely common. I want to be honest about that. Dry air, hard floors, not moisturizing, these all cause cracking. But here's the version I worry about. Heels that crack in summer. Heels where you have used every lotion on the shelf for 2 years and nothing works. Heels where the cracks are deep enough to bleed. That is not a skin problem. That is a nerve problem. Diabetes damages a specific category of nerves called autonomic nerves. These are the nerves that control things you never consciously think about. Your heart rate, your digestion, the moisture level of your skin. When diabetic nerve damage reaches the autonomic system, the sweat glands in your feet begin to malfunction. Your feet stop producing their natural moisture from the inside. No amount of lotion repairs that because lotion addresses the surface. The source of the dryness is below the surface. And those cracks, those deep, painful fissures in the heel are not just uncomfortable. They are open wounds on a foot with compromised circulation in a body with elevated blood sugar. That combination is exactly how minor cracks become serious infections. Podiatrists and autonomic medicine specialists recognize chronic treatment-resistant heel cracking as a clinical flag for autonomic neuropathy, a condition directly tied to long-term elevated blood sugar. It's one of the things a good foot specialist will ask about, specifically if they are screening you for diabetic nerve involvement. My daily recommendation: apply a thick moisturizer or pure coconut oil to the soles and heels every night before bed. But here's the critical detail: never apply moisturizer between your toes. That trapped moisture becomes a breeding ground for fungal infection. Keep it to the heel and the sole. And drink at least 8 glasses of water daily. Hydration works from the inside out. Before we go further, if nobody has told you about this channel yet, I want you to hit subscribe right now. Every day I sit down and talk through the health topics that matter most after 60. No fluff, no scare tactics, just straight information you can actually use. You deserve to have that in your corner. Sign number 6. Persistent swelling in the feet and ankles. Swollen feet after a long day on your feet, understandable. Swollen feet after a long flight, normal. But if you are consistently sitting down at the end of the day with swollen feet and ankles, and you're pressing your finger into the skin and the indentation stays there for a few seconds, that is called pitting edema, and it is not something to ignore. Here's the connection most people don't know. Your kidneys are responsible for managing fluid balance in your body. Every drop of blood you have passes through them to be filtered and cleaned. When high blood sugar damages the kidneys over time, and it does this silently, gradually, with almost no symptoms, the filtration system begins to back up. Fluid accumulates, and because gravity pulls fluid downward, it pulls in the lowest part of your body, your feet and ankles. Your swollen feet in this case are not a foot problem, they are a kidney problem. The feet are just where it shows up first. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes. And lower extremity swelling is frequently the first visible sign that kidney function is being compromised. 1 in 3. That is not a rare complication. That is nearly the norm. My daily recommendation: when you rest, elevate your feet above the level of your heart, even just propped on a pillow. This helps pull accumulated fluid back toward your core. Reduce sodium in your diet, because salt causes your body to retain water and significantly worsens swelling. Read food labels. Many canned soups and packaged foods are loaded with sodium in amounts that would shock you. And if the swelling is new, persistent, or worsening, bring it up to your doctor at your next visit. Don't wait for your next annual checkup. Make a call. Now, I want to talk to the men watching this specifically for just a moment, because sign 7 is the one I see most often misdiagnosed in men over 60. And by the time the real cause is identified, most of them have been covering it up with ibuprofen, with ice packs, with "it's just an old injury acting up" for longer than they should. Sign number 7. Sharp electric foot. Pain that gets worse at night. This is the sign that gets mislabeled most aggressively. Arthritis, tendinitis, plantar fasciitis, old sports injuries, bone spurs. I have heard every one of these diagnoses applied to patients who are actually experiencing diabetic neuropathic pain. And it matters enormously because treating a nerve problem like a joint problem doesn't work. The pain doesn't go away, it gets worse. Here's what's happening. When nerves are damaged enough by chronic high blood sugar, they sometimes don't go quiet. Instead of producing numbness, they become hyperactive. They start firing random intense signals that your brain interprets as severe stabbing pain. Some patients describe it as an electric shock. Others say it feels like a hot needle being pushed through the foot, and it almost always intensifies at night when there are no other sensory signals to compete with it. Think of it like a car alarm that got jostled in a minor fender bender. Now it goes off randomly at 2 a.m. for no reason anyone can see. The car is fine, the alarm mechanism is broken. That's your nerve. It has been damaged. And now it's sending alarm signals your brain has no choice but to register as pain. Multiple clinical studies and systematic reviews, including research published in major peer-reviewed journals, consistently find that painful diabetic neuropathy affects approximately 25% of people with diabetes and is frequently and incorrectly attributed to arthritis or age-related joint deterioration by both patients and, unfortunately, some physicians. My daily recommendation: every morning before you put weight on your feet, spend 5 minutes stretching. Flex your feet, circle your ankles, gently pull your toes back. Get the blood moving before you stand. And every night before bed, give each foot a gentle circular massage along the sole and up the ankle. You're not curing the nerve damage, but you are improving the blood flow that nourishes those nerves. If signs 1 through 7 tell me something is beginning, sign A8 tells me how far it has progressed. This is the one that makes me sit forward in my chair during an exam. And almost every single time I bring it up, the patient laughs and says, "Doctor, I've had cold feet my whole life. My husband has stolen the electric blanket from me for 30 years. And I laugh with them. And then I ask, "Are your feet cold in July?" Sign number 8, persistently cold feet. Regardless of the season or how many blankets you use, there's cold feet from a chilly night, and then there's cold feet that are cold in August under heavy blankets, while the rest of your body feels perfectly warm. That second version is not about temperature, it's about your blood vessels. When blood sugar damages the blood vessels over time, and specifically when it causes a condition called peripheral artery disease, those vessels narrow and harden. Warm, oxygenated blood that should be flowing freely down into your feet and toes begins to struggle to reach the far end of the line. Think of your circulatory system like a heating system with pipes running to every room in your house. When those pipes narrow from buildup, the heat doesn't make it to the far rooms. No matter how high you turn up the furnace, the room stays cold. That cold isn't about the weather outside, it's about the pipes. The American Heart Association identifies peripheral artery disease as affecting 8 to 12 million Americans and names diabetes and smoking as the two strongest risk factors, with diabetes being the dominant driver in older adults. Persistently cold feet are one of its earliest and most consistent symptoms, and yet most patients chalk it up to just being that way. My daily recommendation: a 30-minute brisk walk every single day, not a stroll. Purposeful walking, arms moving. This forces warm blood into the lower extremities, strengthens vessel walls, and over months of consistency can actually slow and partially reverse early arterial narrowing. Start with 10 minutes. If 30 feels impossible, the point is to start today, not next Monday. We've made it to sign 9, and I saved this one for last deliberately because it is the quietest sign of all 9. It doesn't hurt, it doesn't swell, it doesn't burn. It asks absolutely nothing of you. It just disappears silently and almost no one notices. Sign number 9. loss of hair on the lower legs and the tops of your feet. Right now, look at your lower legs and the tops of your feet. Is the hair there thinner than it used to be? Is there a zone where no hair grows at all, even though it grows normally higher up on your leg? Most people who notice this assume it's just aging, and they're partly right. Hair does thin with age. But there is a very specific pattern of hair loss on the lower extremities that has nothing to do with age and everything to do with blood vessel damage. Hair follicles are living structures. They need a constant supply of oxygen and nutrients to produce hair. When the blood vessels supplying the feet and lower legs narrow from diabetic vascular damage, those follicles begin to receive less and less of what they need. They don't shut down immediately, but gradually over months and years, they stop producing hair. The follicles are still there, they just can't access the supply line anymore. Think of it like a row of plants in a garden where the irrigation line has slowly been narrowing. The plants don't die overnight, they just stop growing and then quietly they go dormant. Vascular specialists and podiatrists consistently recognize hair loss on the lower extremities as a clinical marker of peripheral artery disease, one that physicians examining diabetic patients are specifically trained to look for. The connection is well established in vascular medicine. Diminished blood flow starves the follicles, and the follicles quietly stop producing hair. My daily recommendation right after this video: look at both legs carefully. If you notice the hair on your lower legs or the tops of your feet is significantly thinner or absent, while hair grows normally above the knee, schedule a blood glucose test this week. Not this month, this week. A fasting blood glucose test costs approximately $12 at any certified lab. For most of you watching, Medicare covers it. $12. That is what early detection costs. We've covered all 9 signs, and before I close, I want to say something clearly. I don't want you to leave this video feeling afraid. I want you to leave it feeling equipped. Because every single one of these 9 signs, everyone is more manageable when it's caught early. Diet changes, daily walks, a $12 blood test. These are not heavy lifts. They are small actions that done consistently can protect decades of health. So here is my one request. Tonight before you sleep, sit somewhere with good light and spend 30 seconds looking at your feet. That is all I am asking. Just look. If you see or feel anything on this list, call your doctor tomorrow. Not next week, tomorrow. Let's recap what you now know. 9 warning signs your feet may be showing you right now. Tingling and numbness burning at night. Wounds that won't heal. Ankle discoloration. Cracked heels that resist treatment persistent. Swelling. Sharp nerve pain at night. Persistently cold feet. And unexplained hair loss on the lower legs. Any one of these warrants a conversation with your doctor. Don't wait. Don't talk yourself out of it. Now, if this video helped you today, do one thing before you leave. Hit the like button right now. It takes 1 second and it tells YouTube to put this in front of more seniors who need it just as much as you did. And if you have a friend, a spouse, a sibling, someone whose feet you've been quietly worried about, share this video with them today. Not tomorrow, today. You might be giving them something that changes everything. If you're not subscribed yet, hit that subscribe button and ring the bell. I post every week. Topics like this one, things I talk about with my patients that most people never hear outside a doctor's office. But here's what I didn't cover today, and it matters just as much as everything I did. What happens after the diagnosis? What do you eat? What do you stop eating? And what does research actually say about reversing early blood sugar damage without immediately reaching for medication? Drop the word next in the comments right now if you want that video. If enough of you ask, it goes straight to the top of my list. That answer is coming. Don't miss it.